Hello, everyone, and welcome to another episode of our Global Ambassadors interview series. Thank you to Mr. Willo Brock today for joining us. Before we start into the questions, could you please give us a quick introduction to yourself and a bit about your background?
Thanks, Dia. It's great to be here. As a background, I've been in international relations and international development for 30 years, starting with the Dutch Ministry of Foreign Affairs and working both with governments, non-government organizations, and private entities. Worked abroad in Asia and Africa for about 15 years and have the last 15 years spent time in global health, first in antibiotic drug development for TB, drug in TB Alliance, an organization based out of New York, but working globally. After that, I moved to Fine Diagnostics, which coordinated the COVID response in diagnostics, and have been recently, about a year ago, worked with CEPI as their EU representative, looking at vaccine development for pandemic preparedness, all from a global health and a global health, equity perspective.
Amazing. And so you have a very international background. You've worked in, policy, but also in global health. So given your background, given your experience, what do you think are the major global health challenges faced today, and how do you think is best that we move forward to tackle them?
Of course, this is a very important moment in global health. This is given the elections last year in the US has been strengthened, as it were, as a topic on the agenda, but this was long coming. This is not a single country creating this. The question on how ownership of public health across the world is organized, how collaboration in global health is organized globally, and how we can have equal partnerships between countries, between players, is an essential topic. And that, of course, in an area when there's a lot of frictions that we all are aware of, is sort of exacerbated in terms of its importance. So the question around um, autonomy, which is a big one nowadays because of the experience with COVID, can we get access to the vaccines, to the diagnostics, to the even the masks and the
Mhm.
needles for the injections? How can we organize ourselves so that we are safe and that the population that I'm as a politician worried about can have is an important one. However, what we need to realize, and that's I think coming to the question on the challenge, is that we said this during COVID over and over again. We can only be safe if all are safe.
Yeah.
That was very true then, and it's very true now. And
Mhm.
even though it's important to look at autonomy, to look at manufacturing capacity, R&D capacity everywhere in the world, we have to recognize that this is a global issue. So global collaboration reduced has been reduced. There is some nervousness about collaboration based on the experience during COVID,
Mhm.
based on the current geopolitical status. But I think that is still the most important thing in the world, and that's why global entities, including WHO, including the EU, including Africa CDC, are still going to be essential,
Mhm.
and need the support it can get to be able to be effective for everyone around the world.
Yeah, and you said that collaboration is vital to solve these global health issues. So how do you think, how important do you think convergence and collaboration between the G7 and G20 agendas are in addressing such global health threats?
Of course, the G20 and the G7 overlap, right? The G7 are also G20. So
Hmm.
the reason why, when I initially got involved with the G20 partnerships, which at that time didn't have that name yet,
Yeah.
but it was still a concept and an idea, we were already talking about G7 because G7 is essential. It has a lot of capacity in R&D, in knowledge, but also obviously in terms of investment opportunities
Mhm.
into health and health tools, new antibiotics, new vaccines, new diagnostics, all of it. But what we recognize very early on is that if you look at global issues, pandemics, if you're looking at antibiotic resistance, if you don't look at that at a global basis, then you're going to miss. You're going to miss. So when you look at the G20, the interesting thing is suddenly at India, you suddenly at Brazil, South Africa. So you still have G7, but
Mhm.
now you have a really powerful emerging bloc where there's a lot of expertise, where there's a lot of quality manufacturing, where there's a lot of knowledge about issues that we may not have as well in Western Europe and North America and Japan and in Australia. So I think the convergence is continuing the same as when we started looking at this, is we need global solutions and we need the power of the majority of the world. And if you bring in the G20, obviously with China, India, you suddenly add a whole lot more capacity than if you're looking at just Europe and North America,
Mhm.
Australia, and so if you're G7. So I
Mhm.
think G7 is essential because of its ability to bring both science and funding to the table.
Mhm.
But the G20 is becoming an equally powerful bloc. Now, I would even say, coming to your question, that then the next step to G77 is quickly made. But
Mhm.
now we suddenly are truly talking about global collaboration.
Mhm.
Um, the COVID vaccines were developed in trials that were taking place in Southern Africa, in Brazil, and in India. They weren't happening in G7 countries.
Mhm.
And we learned there that we need to have those relationships, those collaborations ready when something happens to be able to quickly respond for the good of the whole world, including high-income countries. So I think that's where the convergence comes from, an understanding that there is a um, mutual need to collaborate.
Mhm.
And this is sometimes missing. There's sometimes we can just buy, as it's G7, we can buy ourselves. I mean, I'm from the Netherlands, I'm from Europe, I'm from a G7 country, but we couldn't do this without all these other partners. So this is why we need to be a bit more humble in the G7, and we need to be a little bit more vocal in the G20 to
Mhm.
say that these type of collaborations are needed and that these investments in health are the best economic arguments you can have on how you would invest. The investments in health R&D are not costs. They're not expenses. They're not money that is sort of replenished every year and is just needed to run the show.
Mhm.
They return economic benefits, and this is why, again, the G20 and G7 is so important. It is an economic bloc.
Mhm.
So having health as an investment, health R&D as an investment is an important message we need to keep bringing. If we want return on investment, health R&D is one of the best ones that is there. And this is
Mhm.
true both for, let's say, the G20 minus the G7, as well as it is for the G7. And it's certainly true for the G77. Poorer countries will see much more economic development when health and social security is more solid than it currently is in some cases.
Hmm. Completely. I think health is definitely an investment, and that's how you approach it with politicians. We approach it with legislators, is that's how we appeal and get that convergence and collaboration with everyone. And speaking about this whole world approach where we have everyone, no country is left behind. And I think that's something the partnership, the G20 and G7 Health and Development Partnership does very well, especially at the Health 20 Summit every year, is we ensure that all countries that want to be represented are represented. So how else do you think that the partnership can help towards prevention or move towards solutions to global health issues that are happening?
That's a hard question. I think the G20, when the G20 Health Development Partnership was set up and before it became G20 and G7, I think this is a good recognition. There wasn't any health on the agenda.
Hmm.
So our first goal was to put it on the agenda and showcase how it was relevant for the G20. And we're now in a situation that is almost a given,
Hmm.
which is a very powerful achievement that many organizations and people have contributed to, and definitely the G20 Health Development Partnership has helped.
Hmm.
Obviously, Corona has helped. There's other issues that have helped. The question now is on the political agenda. What is exactly the topic that, from an international collaboration point of view, we should push for? What are the next stages? What are the topics? Because the risk we have as an organization is we continue to speak to ourselves with
Yeah.
organizations that are very committed already to global health and that know that health is important. So I think the topics that are important is showcasing this relevance for other topics that are on a political agenda. So can we talk to ministers of defense to say, if we're talking about biosecurity, this is what health is really about. Health is biosecurity.
Hmm.
How can we improve our health R&D infrastructure, our health delivery mechanisms to ensure that in a slightly more fragile world, that we can still guarantee access to medical care for everyone in the world? How can we showcase that new antibiotics are important also in an area where we see increased number of environmental challenges? You know, your earthquakes, we see obviously a lot of climate related um, events happening around the world.
Mhm.
Those will require very efficient and novel, innovative health products that are required. So I think where to come to your answer to your question indeed is ensuring we stay relevant by not continuing to make the point that health is important. Everyone's already convinced about it now, but
Mhm.
linking it to other policy agendas. And at the moment, obviously, security, um,
Mhm.
climate and environment, for instance, are two of the big ones, but also economic development, because still the G20 and the G7 are about economics, and health is a very important driver of economic and social development. And those are the ones ultimately ministers of finance, prime ministers, and other politicians would really care about, whether elected or not. This is the area where every human in the world looks at their government and says, if you can't
Mhm.
deliver me a healthy and prosperous life, then I'm going to be upset. Right? So
Yeah.
that linkage to other policy agendas, I think the one we should do a little bit more of.
Hmm.
Um, and we have the arguments, but we need to get outside of our cocoon of people that we already agree with and
Yeah.
get on the agenda of the other topics.
Yeah, I think that's very interesting. I think that's the risk that a lot of organizations or groups come to is you just speak to people who already know that the topic is so important and so vital. We need to speak to people who may not even think about it. Like you said, the partnership work to get health on the agenda. And it's a very successful achievement is now health is on the agenda. So they're very insightful comments. Thank you so much. Thank you so much for your time today.
Thanks, Dia, and good luck to us all to make sure that we can keep driving health innovation forward for everyone in the world.
Yes, thank you so much.